Queens Medical Center nurses are headed to work this morning with a new 3-year contract.
The nurses union believes it's another win, not only for nurses, but patients. Chris Latronic joins us now live from the state capitol with more. Good morning, Chris.
Good morning to you, Sarah, Sam, and everybody on this Aloha Thursday. That's been the goal all along, is quality patient care when it comes to ratios, as well as safe staffing. And that's been the win when it comes to the Queens contract, as well as Kapi'olani. But still a lot more needs to be done, as the nurses will be gathering here at around 10 a.m. for a press conference in support of legislation to help put it into law when it comes to these different issues. And here to tell us more is Terry Lynn Carvalho-Luke, who is the president of the Hawaii Nurses and Healthcare Professionals. Good morning to you. Big win happened yesterday, but also kind of coming into today with supportive legislation. Tell me about what's happening.
So we're really pleasantly surprised that the community has come out to help support the nurses. And this is one reason, as the community sees how hard nurses work in Hawaii for their benefit, for better patient outcomes. We want to introduce this law, and with the help of House Representative Sean Quinlan, and along with Senator Aquino, they are moving that bill through the legislative process to make sure that the community of Hawaii is served to the best and the way it's supposed to be served. So we are looking forward to this legislative process.
Yes, and this is just new for the states. Other states have actually adopted this type of legislation as well, right? Tell me a little bit about it.
Correct. There's approximately 13 states and more that are putting legislation through this season. So we want to make sure that we have standardized care here in Hawaii. It's not up to individual hospitals as to how many nurses will be there to take care of patients. We want to make sure that, based on evidence that's come through research over the years, that we make sure that every single patient has what they deserve, and that we know that even by adding one patient to that load, the mortality rates increase. And we definitely don't want to see that when it comes to any of our ohana here in Hawaii.
Yes, and with the passing of those recent contracts, you guys have already been seeing the benefits, right?
Yes, and that's one way to retain nurses. We've seen more and more through these years that nurses just want to leave the field because it's so hard to work in the conditions we've had to. The new norm is not what pandemic levels used to be, and we don't want to be there. We want to be where it should be in order to take care of these patients. So one thing I will say is that we want to recruit new nurses. You know, when they see that the conditions are so bad, they don't want to come into our field. And we want to be proud of the profession that we have. Nurses are leaving the field in crazy numbers, or in their early 50s before retirement, because the working conditions are so hard. So we want to make sure that we have at least 10 more years out of these experienced nurses, and we need that at the bedside.
Thank you so much for everything you do, Terry Lynn, and as well as all the unions who are going to be meeting today to advocate for legislation. We'll be following this story on air and online at KHON2.com. This is Chris Latronic, working for Hawaii, live from the Hawaii State Capitol. Sending things back to you.